My name is Dr. Gloria Tumfo, part of the medical team from Shai Osudoku Hospital. We are here today to embark on a medical outreach for the students. So far it's been interesting. I mean, we have them complaining sometimes of headache, of dizziness. Mostly the ladies, they're in their menstrual period, so mostly they're cramps, right? Yes. So you just advise them to keep on hydrating. We prescribe some medications to help them with the pain, some vitamin C for the immune system, and we advise them to keep healthy in this season of the rains, which is constant. Yeah, they have to make sure they dress well, right, and not stay outside for long for mosquitoes to bite them and get malaria. But it's been interesting. Yes. You're welcome.
Okay, hello. My name is Jackie Cranton and I'm currently with the registration team, and so far so good. It's going well. The students are coming in their numbers and they are registering, so it's going well. Yeah.
Thank you. All right, hello. My name is Kwekwe Siama. I'm part of the pharmacy team. So what we do over is that when the students come in and the doctors are already written the medications that they need, so we just dispense it for them so that they can go and take it when they go to their rooms. Yes. So far the experience has been nice. We're able to interact with the patients, find out their issues and things, and then get them the medications that they need. So it's a very nice experience.
Thank you so much for coming.
Yeah, thank you too.
My name is S.H.S, a pharmacy technician. Thus, we are here as a team, and then we are here as pharmacy unit to dispense medication to the students and their staff, their teachers, and everybody here for free. So far, the prevailing condition that I've noticed among the students is ulcer. It's ulcer. And then it looks as if when you pick any, and it looks as if when you line like 5 students, you can get 3 of them having ulcer. It is very prevailing. So I think we'll speak to them on that tangent to see how we can improve their health condition with regards to ulcer.
I suggest some simple ways we can use as those we are observing or as audience as we talk to us.
Okay, so I think when you look at the causes of ulcer, it can be bacterial and then it can be drug induced. So we would want to caution them, if they are taking drugs, especially the NSAIDs, then they should reduce it. And then also personal hygiene. Since some ulcer can be bacteria induced, when they visit the washroom, they should make sure they wash their hands very well under running water before they eat. It's very important to prevent ulcer.
Okay, my name is S.H.S. I'm a senior nursing officer, and as part of this medical screening, I am at the vital signs point. This is where we check the baseline vital signs before they proceed to see the consulting doctor. Then we take it up from there. So far, it has been cool. Everything is going on well. The screening seems to be very seamless. We've not had any difficulties yet, so I can say so far so good. Thank you very much.
So, some of the common issues that we have in the country currently is that people fear to go to the hospital. When they face any little headache, they feel they will just take solids from para, Gibidol, and other painkillers. What advice do you have?
Okay, as a medical practitioner, I will highly discourage it, okay? Because the symptoms you might be having, you might think it's just a normal headache, but that might not be the case. So I'll encourage all and sundry that the slightest symptoms that you experience, kindly visit the nearest hospital so that you can be thoroughly checked and we take it out from there. So abusing drugs is highly discouraged. So please, let's stop it. Come to the hospital. We are ready for you. Thank you.
Anyone? So you put your hand on. Hello everyone, my name is Ibawati. I'm a nurse and as part of the medical screening team. And I would say working with the students has been very cooperative, and I must say I'm enjoying what I'm doing now. Thank you very much.
My name is Naomi Nagaji and I'm a nurse. I'm checking the BP for adolescents in the school. And then,
what's the experience so far?
So far, all the BPs are normal, except only 2.
Daniela. Okay. Susanna Usuaidu, a pediatric nurse specialist. I'm here to support the Purple Month. So far, we are checking the BPs for our wonderful adolescents here. Because they are not, most of them are not adults, we are using the BP percentiles to check to see if they are really within the normal range per their age or above. We've observed that most of them are within their normal range, except few. So far we are seeing everything is going on smoothly.
What advice do you have for our students as far as medical issues are concerned?
Okay, what I would say is they should be proud of themselves. They shouldn't depend on anyone. We are all different. We come from different families. Some in their family they are fat, some they are cute. You don't have to compare yourself with anyone. Be confident with yourself. That is you. All that you have to do is take care of yourself, your diet, drink water, and above all, exercise. That's what I will tell them. So I'll end again and say that they should be what? Proud and confident with themselves. They shouldn't compare themselves with their friends. They are from different families. Thank you.
So I'm Redeemer Edem Kung Fu, and I'm in charge of registering the students, and the experience so far is good. There's no stress. Thank you.
So my name is Derek Tete, and then as far as this exercise is concerned, I'm checking their HBs and then their screening them to see if they have malaria. Yes. So far the experience has been okay. They are not making it difficult. Yeah, they are calm, and then everything is going on smoothly. Thank you.
My name is Marina. So I'm doing the registration and also writing the results.
The experience over. Are you enjoying what you are doing?
Yes, please. So I write the result if it's positive, and then I'll tell my colleagues to register it on the paper.
So your name?
Okay, hello, my name is Ruth Katamanso. I'm a wellness nurse specialist at the Shai Osudoku District Hospital. So far, we are in the Ghanata school to screen the children. And what I have seen is most children are hypertensive and hypotensive. Normally, we do relate hypertension and hypotension to adults, but it's surprising that these young ones are developing hypertension. So when they come, we check and then we counsel them on what to do. We find out their lifestyle and what they can do to bring it down. So basically, we've started screening children and educating them on the incidence of hypertension. Hypertension is very real. So at this stage, if we are having hypertension at this early age, and that means we have a lot to do with our diet, with our way of exercise, and then our lifestyle. I think when we continue with it, it will help reduce hypertension in the system. Thank you very much.
Okay, but let me worry a little. So specifically, what are some of the things that we do that engage or help let us get this?
So our lifestyle, one, lack of exercise, alcohol, smoking, and then our diet. Some of us, we don't eat well very late in the night. Sometimes too, we take so much salt that affects our BP. Others are also having family history of hypertension. So basically lack of exercise, and then stress. Most of the interviews, you realize that they are going through psychological stress and physical stress. So all these things come together to increase the incidence of hypertension. So I think when you are being counseled on all these and you go about it well, you are going to reduce your risk of developing hypertension. Thank you.
Thank you so much for your time.
You're welcome.
Hello, my name is Mavis Zouna. I'm the quality manager for the hospital, but for the health screening here, I'm serving as the coordinator. And so far it's been good. We came here as early as 7:30, gone through health talk concerning mental health, and now we are on the health screening. It's been good. The students have been very cooperative together with the staff of the hospital. And it is our desire that it will not end here. It will be something that can be done annually for the students, because picking up any health issue early is very important. Because the best point to be able to tackle a situation is when it is picked early. So we believe that this will be an encouragement to the school, and for us it serves as encouragement too, because they are in our catchment area, they visit our hospital. So if we are able to pick up anything early, then it will help all of us. And for the general public, I will say that it's very important for us to also step out all the time, not only when you are sick, but once in a while you have to step into a health facility and be able to do a review of your health status, what we call medical screening. Is very important, so that if there is anything, it can be picked early and it will be treated early. So thank you.
Yeah, so I'm Dr. Richard Osei. I'm part of the team involved in consulting the students when they've gone through the various parts of the outreach. So if they have any problems, any questions, anything they want to talk about, they relay that to me, and I kind of assess them and then give my judgment and help them with any problems that they might have.
So what advice do you have for the student body, the staff?
Okay, so generally I've seen that not most of them come are quite healthy, but a lot of them complain of or have had history of what we call gastritis or ulcer in the past or whilst on admission. That's associated with stress, infrequent or feeding, and like maybe going long periods of fasting. So just advise the students to maybe stick to well-timed meal times and like just trying to relax. School is generally stressful. Spending time relaxed and also well hydrated, drinking a lot of water so that they don't stress their stomach too much.
Yeah. No, this one, let me chip in this. Ghanata is 90 years.
Okay.
So what advice or what congratulatory message do you have for the whole Ghanata and the whole students in and outside the world?
Oh, okay. So getting to 90 years itself, it's a good thing and deserves all the praise that the hospital. I said the hospital, the school is it deserves all the praise that the school is getting. I'll just advise that they keep doing what they are doing. Invest more in infrastructure and teachers and things that would make the students more comfortable, which will facilitate them learning and able to get good grades so that they become important people in the future. And kudos to the school, the administration, and the old students who bring in support for the school. It's helped a great amount, and I've seen it in this short outreach that we are doing.
Thank you so much.
All right.
Hi everyone, my name is Dr. Farah. I'm a pharmacist, part of the outreach team. So your students are very well behaved and they comported themselves very well. Your environment is serene and we've had a very good and fruitful outreach. So my advice, we have to eat healthy. We are looking at preventative care, health care. So it starts from us, what we put in our system, the water we drink, the food we eat. Most of our students, we realize, come to the facilities with gastrointestinal problems. Every time their stomach are hurting, they are vomiting, they are poo-pooing. So as parents, let's look at what we give our kids, our carbonated drinks, our spicy foods and all that. Let's ensure that we give our children more fruits and vegetables so that they will grow healthy and they will not be obese and then have diabetes and hypertension in the end. So thank you very much.
You're welcome.
Thank you so much for having me.
Please introduce yourself.
My name is Gloria Sarkodie Ado, the unit head of Mental Health Department, Dodua Hospital.
Okay, so madam, what are some of the common health problems young people face today?
So in our current generation now, the commonest one they face, we have respiratory tract infections, the asthma, the allergies. Then you move to the infectious side, where we have HIV, hepatitis, COVID, malaria, typhoid, and all environmental conditions.
So what can people do to improve their daily health habits?
So first of all, is routine checkup. Know earlier and prevent it. Then eat very well because you are what you eat. Do a lot of exercise, not the vigorous one, but brisk walking, daily stretchings, and then having a quality sleep. You know, because of our social media and a lot online, people don't sleep. And those who are not sleeping well are the very people who get themselves into so many health conditions. And then managing your stress as well. We all go through stresses, but know what stresses you up and how to manage it effectively.
So since you have mentioned regular medical checkup, what are some of the warning signs people should never ignore?
So severe headaches, your inability to sleep well, you not eating well, general bodily pains and aches, and sometimes poor eating habits or loss of appetite. When you see some of the signs and symptoms, you need to wake up. Know that something is not too well in your system and must take the necessary step to prevent further complications.
Okay, madam. How can somebody know that he or she is struggling mentally?
So first of all, we all know mental health affects the way you think, you feel, and behave. The first thing is your thinking pattern. When your thoughts changes to a more negative thinking, it is a sign. When you start feeling badly, you are so moody, moving from one mood to the other, it's a sign. And then when you have questionable behavior, you talking to people anyhow, poor interpersonal relationship, it is a sign that mentally you have to wake up.
What are healthy ways to deal with stress and anxiety?
So first of all, know what is even stressing you up. Your ability to know will help you to know the necessary step to take. Know your stresses, label them, manage them accordingly. And then make sure you sleep very well, because one easiest way to manage stresses is to sleep after you've known what the problem is. And take your time in making so many decisions. Because when you rush, that's when you go into trouble mentally.
Before we leave you to go, let's handle this question. How can families support people with mental health challenges?
So first of all, we shouldn't hide our loved ones who are dealing with mental health conditions. Because of stigma, people hide instead of seeking for help and support. When you see a loved one dealing with any mental health challenges, report to the health facility where we have trained professionals. If you don't have any health facility closer to you, go online, look for mental health services that can render virtual services. Reach out to them and they will give you the specific help where the need be. Secondly, if you have relatives who are dealing with mental health conditions and they are on medication, encourage them to take, because it is the medicine that helps to reduce the signs and symptoms for them to live a holistic life. But before I end with my talk, I would want all of you to know that none of us here is immune to mental illness. Just as you can go for vaccination for certain conditions, you cannot vaccinate against any mental health. So be responsible, sleep well, manage your stress as well, think positively, get somebody closer to you who you can reach out to in times of need. And then be very prayerful, or whatever supernatural you believe in, go straight to them. And then that spirit of community, tend to love each other. Know when people are not well and give them the necessary support so that we live as one people in a nation. Thank you.